Good afternoon. Thank you all for joining us here this afternoon. I'm Scott Sasser. I am the Acute Care Chief Clinical Officer for Prisma Health in the Midlands. I'm an emergency medicine physician by training and background, and we appreciate everyone's time and being here with us today. While we have been preparing for coronavirus since this illness first emerged several months ago, our successful preparedness is something that is built upon what we do every day. At our core as an organization, preparedness and readiness is a part of our yearly, our daily, and our weekly activity. We want to ensure that we as a healthcare system are prepared to respond to threats like this and meet the needs of our community. Recently, we have, in response, stood up our hospital incident management team. And that team is designed to coordinate the response not only across Prisma Health, but specifically in the Midlands as well. Some key things that we have done over the past few days is we have activated our novel disease unit team. These are individuals who have specific expertise in managing patients with novel diseases that can help and assist in patient care. We have been very diligent in our communication efforts with our team members, with our community, and recognizing that this is a dynamic and fluid situation, we have focused on a continual updating and review of our policies, our procedures, our operational protocols, our patient flow, and really depending upon the guidance that we get from our state and federal public health partners. We want to take a moment to really commend our team members, our physicians, our providers, our nurses, and everyone who's a part of our team on the efforts and their care for our patients over the past few days. Every one of them, and in fact, each of us is really, in my mind, we're living what our purpose is, to inspire health, serve with compassion, and be the difference. Our community needs us. We are here to respond. It is who we are. It is what we do. I do want to take a moment to just thank our partners and colleagues at DHEC for the leadership that they have shown throughout this process. This is a big effort, and they are to be commended for the coordination and leadership they have shown. I'd also like to thank our partners with the SCHA for their efforts to coordinate the response and the communication across hospitals. I'd now like to take just a moment to introduce Dr. Linda Bell, the state epidemiologist with DHEC, to provide a few comments. Dr. Bell? Oh, sorry.
Thank you, and good afternoon. Late yesterday afternoon, March 8th, DHEC received a presumptive positive result for an additional individual who was tested for the novel coronavirus COVID-19. The older man is a direct contact, meaning had close face-to-face contact with a previously announced presumptive positive case. He is also from Camden. He was evaluated at a healthcare facility, was not hospitalized, and is currently isolated at home. With these new presumptive positive cases, we now have an indication of community spread in Camden. However, I want to reassure the public that DHEC has been preparing for the introduction of the virus in South Carolina for weeks, and we have planned, prepared, and tested our ability to respond to public health threats like COVID-19. Our contact investigation protocols are working as we are appropriately identifying and connecting with individuals who could have been exposed to this illness. This helps us to limit potential spread, while we continue to also identify potential exposures based on travel history and other factors. It's all of our responsibilities to help prevent the spread of illness. Our key recommendations at this time are to stay home from work or school or community gatherings if you are ill, to protect others in the community if you're sick, to reach out to your healthcare provider if you are showing symptoms such as fever, cough, or shortness of breath, so you can be appropriately evaluated in the appropriate setting. We are still learning about this virus, and we are committed to keeping the public informed. As we learn more, we will continue to provide updates as quickly and as timely as possible. I'd like to reemphasize that each of us has an important responsibility to our friends, our family, and our communities to stay at home when you're sick and to continue to practice good hygiene, effective measures in preventing the spread of all illnesses. I also want to thank all of our public health officials, our healthcare providers and healthcare facilities, and various leaders and groups across our state for their continued dedication to protecting the safety and health of South Carolinians. For the latest information, I encourage you to visit our website at scdhec.gov/COVID-19. We will be providing updated numbers and information later this afternoon. Thank you.
Thank you. Excuse me. Thank you, Dr. Bell. I would now like to ask Dr. Steve Shelton, who's our Medical Director for Emergency Management in the Midlands, to come to the podium and discuss how we care for patients in this environment. Dr. Shelton.
Good afternoon. We often get questions of how do we care for one of these individuals that present to our facility. I have to assure you, we take care of patients with infectious diseases on a daily basis. So we're accustomed to doing this, and we feel very confident in our skills. We have an extensive group as far as infection prevention who has done an awesome job in getting us ready to make sure that our staff, patients, and community are safe when any of these patients are cared for. So specifically what occurs when a patient arrives, we create a secure portal or a clean area to make sure that that patient can make it from their site of entry to our isolation room. Once that patient's placed in an isolation room, our staff is dressed in personal protective equipment. But most importantly at that time, we have established a team member who is defined as a site manager. That site manager's primary role 24/7 is to make sure that the folks caring for that patient are safe, as well as the rest of our patients are safe while that individual is receiving their care. They specifically watch each individual care member that enters that room put on their protective equipment as well as take off that protective equipment. They monitor who enters and exits that room. They monitor any materials that may have to come out of that room to be disposed of. They are on site specifically to manage any acute emergencies or unknown events that may occur. So these individuals have done an incredible job of making sure that we can provide the care to these individuals while keeping everyone else safe. We've put extensive work into our planning process, into preparing for this. We're very proud of our individuals that have worked hard on this, specifically some of our employee health individuals who are making sure that our employees are healthy and well when they provide care for these patients. This team plans to remain focused and dedicated in providing the best care that we can for our patients. At this time, I'd like to introduce Dr. Sangeeta Dash, who is the lead infectious disease physician for this case.
Good afternoon. I just really want to remind everyone of your good infection prevention practices. Hand hygiene is key, so really good hand hygiene. Practice good cough etiquette, meaning coughing or sneezing into your sleeve. Remind everyone not to touch their face, nose, and eyes, and stay home if you're sick. Currently, the flu is still circulating in South Carolina, and therefore, if you've not received your flu shot, you should consider, we do highly recommend that you get your flu shot. We have been coordinating with Prisma Health physicians and community physicians to be sure that everyone has all this information. We are also very glad to let everyone know that we have free online visits. You need to log on to prismahealth.org/virtual-visit to use this resource, and the discount code is COVID-19. We also want to reassure the community that Prisma Health is working diligently with SCDHEC and South Carolina Hospital Association, along with other partners, to keep you healthy and safe. Thank you.
Thank you. At this time, we'd be happy to entertain any questions and answer any questions that we can, and all of us are available for that. And I'll try to. Yes, ma'am.
What are some of your biggest needs right now as caregivers?
I'm sorry, I didn't hear that.
What are some of your biggest needs right now? What resources do you need?
Yeah, I think from a resource standpoint at this time, we're good. Our biggest need is a continual communication with our team members and with our community about what we're doing, good practices like Dr. Dash referenced. But from the needs that we have right now, we're in a good spot.
Have you had to bring on extra personnel?
We have not.
How many people have used the new online survey since you launched it last week?
The new online, I don't have the exact data on how many people have used it. The service, the free online visit that Dr. Dash just talked about, is going live basically as we speak. I don't know if anybody else has any data on how many times it's.
Can you give us the URL of that one more time?
I'm sorry?
Can you give us the URL for that one more time?
Yeah. Where's it at? Oh, it's on the sign. Sorry. It's like it's not on my paper. It's on the sign. And it is prismahealth.org /virtual-visit. Can you see it? Okay. Okay.
Do you know how many people have used the call service, the call line?
I do not know that number offhand. Does anybody know?
Can we get clarity from Dr. Bell? Are we up to 8 cases now, or is it still 7?
We have 7 presumptive positive cases. Let me confirm this because we have 2 that have been confirmed by the CDC. But we have 7 cases who have tested presumptive positive.
And there's still the 2 confirmed of those 7?
Yes.
So a total of 7.
Yes.
Have you heard about the possible case in Clemson? Oh, can you tell us what you know about that?
I have not heard about a possible case of Clemson.
How are you treating the patient who's here?
Sure. The disease process is mostly supportive care for these individuals. So we make sure that they maintain a good blood pressure, make sure they maintain good oxygenation, make sure they maintain good hydration, and support them through this process.
Still no medicine or no kind of idea of a cure or vaccine?
There's no specific medication or vaccination available at this time.
Can you talk about how many people in your network you can care for if suddenly several cases presented themselves? Like, what would be max capacity for these kinds of cases for the hospital system?
Surge. We have the capability to surge. We're working on that. We're working on contingency plans in the worst case scenarios. So I can't give you a specific number at this point. We do have a defined number of negative pressure rooms available at this time, but we're also looking at options to create multiple options of non-typical areas, such as potentially rooms that we can make negative pressure, which are currently not, looking at alternatives within our pre-hospital environment, specifically our medical practices, to do some testing and care out there, as well as potentially if we have to go to tents or something like that. We're considering all options as far as expanding.
And is Prisma Health still only caring for one presumptive positive coronavirus patient?
We have one confirmed positive patient, yes.
How many patients have you had to put in these isolation rooms since you guys started seeing cases pop up here?
I don't think we can answer that.
Dr. Bell, back to this Clemson case, Clemson health officials said they were working with DHEC to monitor this patient. Can you describe that process in general? Tell us what you do know about that monitoring situation.
So we ask healthcare providers to notify us if they are evaluating a person suspected to have a COVID-19, as well as to report positive cases to us. And so our process is that if a healthcare provider does an evaluation and it is indicated to test for COVID-19, we may begin to do contact investigations around that case so that should the test become positive, we will have identified the close contacts. Now, as we increase the availability for testing, that would decrease our need and our ability to actually do contact investigations around each new case that's identified. It would be something like the flu in a community where it's not possible to do a contact investigation around each case. But we do continue to do surveillance for possible cases, particularly for the identification of cases in a new community where there is not ongoing transmission. And in those settings, we can do contact investigations and continue to do containment efforts to identify contacts and ask them to self-monitor and self-quarantine. So that should a case become positive, that should they develop symptoms, we limit the possibility of exposing others in the community.
Would we be able to get an update to the students in the Richland County School District 1 who had indirect contact with someone who was presumptive positive?
So the announcement that the school district made gave us no indication that students had been exposed directly to a case. And so we focus our investigations on the contacts of cases. The contacts of contacts, as we define contacts, are individuals who are not ill, are not at risk because they've been in contact with someone who's not ill.
How do you do these contact investigations? I mean, if this person went to a grocery store or somewhere where it's hard to track down who they've interacted with, how do you kind of pinpoint these people that might be potential getting the sickness?
We focus our contact investigations on those who are at highest risk of being infected, and that is on the close contacts. We define that as sort of like within 6 feet, close face-to-face contact who may have the risk of being exposed to respiratory droplets. So casual contacts, going into the supermarkets and things like that, it's not feasible to try and track down all of those types of contacts. There's a much lower risk for that. But we do, however, advise the general public to stay home if you're sick and stay home from school and work and from community settings so that we can reduce the opportunity for the spread in settings where we can't identify contacts.
How do you know if someone's broken the isolation policy? How do you make sure these people stay in isolation if they are at home and not in a hospital?
The individuals that are reported to DHEC that we've made direct contact with, they are given guidance on symptoms to look for, or if they're ill, they're given guidance to self-isolate at home and to not participate in the types of activities that I've already mentioned, and they sign a consent agreement to do so.
Any extra precautions for Camden where you mentioned that there is that community spread now that people should be aware of?
Well, our message has not changed because we tell people to maintain good hygiene, as the infectious disease doctors here have told you. It's the same message that we give every flu season, to stay home if you're sick, and we expect to identify cases in the community. So really, the only thing that's changed is we've always given those messages, but those messages haven't always been taken seriously. And so what we're looking for is actually behavior change, so that it's not a change in the message at this time. Transmission in the community is expected, but what is needed is for people to really pay attention and take seriously the preventive measures that we have.
Are visitation policies at the hospital still the same? Any patient can have any number of visitors, or are you guys going to be restricting visitors?
For the hospital?
Yes, for the hospital.
Sure. We're still following our same flu visitation restrictions. We don't want individuals who are sick at our hospital, as well as individuals under 18. Is that correct? I want to make sure I'm saying the right thing. So individuals under 18, we want to discourage visitation, as well as anyone that's sick. We definitely do not want them at our facility.
Have any Prisma Health employees had to quarantine or anything because of contact with this patient you are caring for?
Go ahead.
No.
Can you guys clarify the guidelines of self-quarantining or staying at home? Is there a specific amount of days someone should do that if they believe they've come into contact with a possible case of coronavirus?
The recommendation for quarantine is 14 days because that's the maximum incubation period for the illness. If they go beyond 14 days without the development of symptoms, then they can resume normal activities.
So they can stay home from school, from work for up to 2 weeks?
That's correct. They should stay home
They should stay home.
if they are contacts to a diagnosed case.
How many isolation rooms does Prisma Health have?
I don't think we can answer that question for you.
What's the capacity for isolation? Are you talking like 1 or 2 people at a time? Are you talking 20? Any way you can ballpark that?
Certainly. We have multiple rooms, but we prefer not to define how many we have specifically. Yes.
Do you have any plans for changes over the next couple days in terms of your response and preparation, or are things staying pretty much the same at this point?
At this point, we are, as I mentioned earlier, this is clearly a dynamic situation that we're trying to stay in touch with what's going on from the state public health authorities, the federal public health authorities, and the epidemiology of this virus, if you will. So right now, we're staying the course. We're keeping our incident command center activated. We're reviewing, like I said earlier, policies, procedures, protocols, communicating effectively with our employees, with our community, and really staying the course and keeping our eye on what's evolving over the next few days.
Do you have a plan specifically for coronavirus, or have you implemented like past plans that you've used for previous?
So we have, as I mentioned again earlier, we have Our preparedness for these events or natural disasters or others are something that we take seriously. It's a part of who we do and how we prepare to serve this community on a daily basis. So we have novel disease plans in place. They certainly have to be adapted and modified for the specific etiology of what's going on, but we have plans in place and have had plans in place to respond to novel disease outbreaks before.
Are the testing kits now in the hospital, or are they still only being done by DHEC and CDC?
We do not have testing kits in the hospital. We rely upon DHEC and CDC at this time. And I don't know if somebody else.
How many people have been tested in South Carolina or at Prisma Health facilities?
I will defer to DHEC and Dr. Bell if she wants to.
The number of individuals who have been tested by DHEC is posted on our website, but now that reference labs are able to perform those tests, the numbers will go up, and we can't monitor the exact number of tests performed.
Any idea how many private labs have conducted tests?
So at this time, I believe LabCorp, a reference lab, has been conducting testing, and Quest Diagnostics is another reference laboratory that is performing testing, and we don't have their numbers.
What would be the best if someone was going to get a test through a reference lab? Would they come to the hospital? Would they go to the doctor's office? How do people get access? Or they just go directly to LabCorp? What's the best way to get access to that sort of test?
They can't go to reference labs to be tested. They must be seen by a healthcare provider, and that can be performed in an ambulatory care setting. We're getting many questions about whether people need to go to the emergency room for testing, and they do not need to go to emergency room if they do not need emergent care. And but a healthcare provider must collect the specimens and submit them to a laboratory for testing.
Dr. Bell, so it's my understanding that the elderly are specifically, susceptible to the worst effects of COVID-19. Are there any extra precautions that DHEC is working with nursing home facilities on to make sure the elderly are properly isolated from the virus?
We have provided guidance to long-term care facilities who care for vulnerable populations, so that they know what to do, and it is somewhat specific to COVID-19, but it is a respiratory illness that those types of facilities are always prepared for.
Right now, the state of North Carolina has just declared a state of emergency. They have the same number of cases, presumptive positive cases as South Carolina. Do you see this rising to that level of declaring that state of emergency if that time should come?
I'm not sure I'm the right person to answer that. We're continuing to monitor absentee rates and reports of illnesses in the community. And as has been said, this is an evolving situation. And if it looks like additional measures are needed for containment and mitigation in our community, then consideration would be given by our decision makers and leaders in the state.
Now that you've treated a case here, can you explain kind of how the symptoms are different than the flu for this coronavirus patient? Just symptoms that when people should go see a healthcare provider?
The symptoms of coronavirus is very similar to the flu. Fever with lower respiratory symptoms like cough and shortness of breath are the main symptoms.
So kind of the same as the flu is what you saw with the patient you're treating?
Similar symptoms, yes.